Hello, everyone. Thank you for being there, and special thanks for the host of this event. Let me share my screen and will introduce myself and begin with my presentation. Today, we will talk about the use of granulated sugar as a natural wound healing agent. It's known from ancient times. In Argentina, was studied by Dr. Leon Ersach, one of our greatest surgeons, since 1976, when he published the first study about sugar and wound care. His first attempts were in patients with necrotic synergic cellulitis. Over the years, the spectrum grew, including large trauma wounds, post-operative descent wounds, infected wounds, and pressure ulcers. Nowadays, we still use it because it was proved to kill any kind of bacteria, including methicillin-resistant bacteria and fungus, increase the numbers of macrophages in the wound bed, and also a number of fibroblasts stimulating collagen synthesis, reduces odor, is cheap, and is easy to perform. It's a useful resource and always available. My name is Gabriela Blumtritt. I'm a general surgeon and a vascular surgeon, Faculty University, medical director of EverMeds, and the president of Argentinian Interdisciplinary Wound Care Association. I have no conflict of interest. Why sugar? Well, let me tell you this. We will talk about using the time structure, about what is sugar and where to find it, how to use sugar in wounds, and when to use it. As we know, the time structure helps us to assess the wound bed. The T helps us assessing the tissue found in the wound bed, establish the need to debride. The E assess signs of chronic infection, like odor, exudates characteristics, pain, among others. The M, it tells us about the need to balance moisture, and the H lets us to observe the edge of the wound and the surrounding skin, looking for maceration, erythema, and eczema. So, what is sugar? In developing countries, natural medicine has been crucial because it has a wide spectrum of practices and therapies that are very common and very useful within our population. Sugar has been used as a natural agent in wound healing over the years. The use of these therapies at the beginning of times were instinctive. They became empiric and nowadays is based on evidence. Particularly the use of sugar as a wound healing agent, from the use of Chancacá sugar cane to the solutions developed by Dr. Ersach and his co-worker. Granulated sugar, refined and unrefined, or sucrose, the liquid state of sugar, it's a carbohydrate found in many root plants, most frequently sugarcane in warm weather countries and sweet beets in cold weather countries. Chemically, it's glucose and fructose bound by a glycosidic linkage, non-absorbable disaccharide, glucose and fructose bond by a glycosidic linkage. It serves to store energy in both vegetable and mammal cells. Once sucrose is extracted from the root, industrial activities takes place, involving bleaching and crystallization. Its sterile conditions are maintained from the manufacturer to the buyers, allowing the health community to use it directly from its package when it is used as a wound healing agent. As already said, in Argentina, Dr. Leon Ersach studied the use of sugar in wound therapy over the last 40 years. His investigation began in 1976 when he successfully used granulated sugar for the first time to treat a patient with a synergic necrotic cellulitis. This led him and his co-workers to continue studying the properties and mechanism of action of sucrose, liquid sugar, in the wound bed. The results were encouraging, so they continued investigating the cellular components in the wound bed and changes in the host inflammatory response. He was an enthusiast in this matter and a great and generous teacher, and shared his experience with us. How does it work? It involves 4 different areas, to say the least. Has immunity stimulating activity, has non-specific bactericide and fungicide action, and it is a powerful debridement tool. As we see, sugar activates the first step in inflammatory change. Macrophages increase them in number and therefore their activity in the wound bed. As a result, a great number of fibroblasts are drawn into the wound bed, and as expected, more collagen fibers are synthesized. In addition, granulation tissue is produced more effectively. As a non-specific bactericide and fungicide action, sugar, likewise other substances, starch, honey, maltose, etc., generates an osmotic reaction in the wound bed, takes water out of the cells and induces cell dehydration followed by cellular apoptosis. The power of sugar in this matter is rather intense than the other substances. Consequently, sugar only provokes death in microorganisms. In other words, high concentration of this solute in the wound bed generates a decrease of water activity in microorganisms, which impair them to grow and replicate, provoking dehydration and cellular death. As a debridement tool, macrophages do a great job removing slough, necrotic tissue, and bacteria from the wound bed. Sugar, by increasing them in number, stimulates their phagocyte activity and therefore the cleansing of the wound bed. It was proven that at the 3rd day of treatment with sugar, the number of macrophages in the wound bed triplicates. Let me tell you something about a collagen protective layer. The number of active fibroblasts in the wound bed produce a 3-dimensional layer of collagen. By the 7th day of treatment, approximately macroscopically appears a shiny cover over the granulation tissue. The strength of this layer is the reason the final scar becomes filiform at the end of the treatment. And how it is used. Granulated sugar can be used directly from its package. This is the most usual technique to use it. Wound has to be filled with sugar, putting much attention in covering every place, even if it's a deep wound or if the wound has tunnels. It has to be stuffed with sugar. Sugar will melt with plasma and lymph from the patient, becoming sucrose. This is the first sugar solution that Dr. Hersage makes reference to. The dressing changes has to be done between 8 and 12 hours in order to maintain stable levels of sucrose. Never use any kind of liquid or solution to clean the wound. Only a dry gauze if it is used to remove the excess of sugar from the edges of the wound, and nothing else needs to be done. Carefully cover it with dry gauze, avoiding the scattering of the sugar. Dr. Hersage had developed another sugar solution that had not been published. Some uses clove oil as a reinforcement to the bactericide and fungicide action that sugar has already had. Some others can be injected into the wound or intraperitoneal, but these solutions sadly had no further investigation. So why we choose it? Because it's a non-specific bactericide and fungicide tool. Even methicillin-resistant bacteria, removes necrotic tissue and slough from the wound bed, has immunity-stimulating activity, activates the inflammatory reaction locally, and increases the number of macrophages in the wound bed. Removes edema from the wound because of its hygroscopic action, stimulates collagen synthesis and promotes a filiform scar, solid and resistant. Reduces odor in the wound within 24 to 48 hours, and it disappeared in 72. It can be used in wounds contained with feces, contaminated with feces, I beg your pardon. Has no caducity date, it is always sterile, it is easy to use, it's always available, and it's a valid choice when everything else fails. So, when to use it? When we have to deal with large infected wounds, when we have to work in low-income areas, with recalcitrant wounds, dehiscent wounds, or battlefield hospitals. What are the difficulties in its use? The disadvantages that we see? It takes time to perform the treatment. It may be painful for the patient. It is uncomfortable because usually when they move, the dressing also does it and it spills the sugar. It is not a clean treatment. Sugar can drop from the wound and attract undesirable bugs, insects to the wound bed, like ants or flies, for an instance. And it requires many changes along the day. So this is the end of our talk and take-home points. We can see sugar acts in 3 of the 4 time premises. It is effective in large and contaminated wounds, promotes collagen synthesis and fibroblast migration. It's easy to use and it's a useful resource always available. Thank you very much for being there today. This is some of our collaboratives in our association, and we want to thank you for this space.